Okay, I'm going to do a super quick video on dry treating a doe. You hear people say that sometimes. What does it mean? What are we doing? Why? There are some times that indicate that you would want to dry treat. Some people live in areas where you kind of have to due to climatic situations, like in Florida if it's really wet. And you have organisms in your soil, even if your doe may not have like an active mastitis situation, and that you need to dry treat to prevent bugs during the dry period from colonizing and creating a problem at freshening. Okay, so we've gone over that a little bit briefly. I'm on milk tests, so DHIA, so I see monthly somatic cell counts on my does, which I highly recommend. If you can do milk test, it is such a wonderful tool. Anyway, I had a doe who was normally very low cell count, and at her last milk test she went up to over 1 million cells. So that was kind of a red flag for me, so I pulled a milk sample, like how I've demonstrated in my previous videos, and I took that sterile sample to the California Animal Health Food Safety Lab, CAF lab, here in California, and they cultured it, and we had no growth. So that indicates to me, okay, well, she's getting close to the end of her lactation. Perhaps it was just a normal high cell count, right? However, I am going to dry treat her because she did freshen with some bacteria last year, or this year, when she freshened in February. So I'm going to go ahead and dry treat her with a real broad spectrum drug here called Spectramast, dry cow. Since she did not come up with a specific bacterium, septophores are really good, real broad spectrum. This is a dry cow formula, which means that it's designed to go in and stay in and not be used daily. It's not for chronic mastitis where we're treating her every day or whatever. Okay, so we're going to need a tube. And I'm just saying this, so this is from my veterinarian. This is all veterinary script stuff. As I said before, I did a milk sample. I'm not just randomly doing this. So you need to work with a veterinarian. You need to find out what you're dealing with and then proceed with treatments. Okay, I love these little alcohol prep pads that I get from Costco. I use that for cleaning the teat end when we get ready to go over there and do the infusion. We have our doe who is milked out. You want them completely milked out. I have milked her out. Okay, and I'm gonna pause real quick here. We'll come back and I will do the actual infusion. Okay, so let's see how this goes. Hopefully you folks can see everything. Like I said, we want to make sure that she's completely milked out. So I'm just gonna strip a little bit more here onto my paper towel. We're gonna be placing the medicine into the orifice. I'm hoping you can see that there. The black spot on the end of the teat is our orifice. Okay, you're always going to want to do this just like how when we prep the udder for milking, you start on the far side teat. So I'm going to infuse this teat first, and then this one. We're not going to use anything like our alcohol pad. We will use separate from one teat to the other teat. Okay, so let's look at so this medicine's a little bit kind of oily, so what I'm doing right now is I'm kind of shaking it, the tube, kind of warming up the medicine. I had it under my armpit for a minute here. It's a little bit cold and the medicine gets a little thick, so I'm just shaking it and gonna kind of try to mix it up as best I can. There are some things we need to view on this tube, so I don't really, I'll show you. So there's a cap, but I want to show you there's two different parts to that. See, I don't want to touch anything. Maybe you can see it down here better. See how there's like a narrowing part on the tip, and then it goes a little fatter down behind it. Now, you do not want to insert this whole thing into the teat orifice. You're only going to insert to that little ridge that's right there. There's a little ridge. Okay, I'm going to recover that just for sanitation. Okay. We're going to use our alcohol prep pad, and you're going to really, really clean that orifice, because what you're doing here, you do have the potential for introducing new bacteria. So we did a culture and she did not have any. Now every time you do an intramammary infusion, you risk introducing more stuff. So that pad was pretty dirty, so I'm actually going to do another pad. I mean, you're really kind of wanting to scrub that teat end and get your pad to where gauze is pretty clean. See, it's not too dirty. Okay, so then we pop our cap off. You're gonna put that little tip right in the orifice. I'm holding this between my middle finger and my thumb, the teat, and I'm kind of rubbing, pushing. Sometimes if you insert just a little bit of medicine, it kind of lubes it up a little bit. Okay, I am starting to infuse now. So I'm also holding that teat, not very hard, but firmly around the nozzle of that infusion tube. I'm watching to make sure no medicine is coming back. I am slowly depositing the medicine right now. You're going pretty slow. You don't want to do anything that can damage this teat. We don't want to cause trauma. So just slowly putting the medicine in all the way. Okay. Now remember, I said I didn't insert that nozzle all the way. Okay, only to the groove. All these tubes have grooves where there's two different levels of insertion. Okay. Now I am pinching the teat end very firmly. I'm pinching the orifice off, and what I'm going to do is push the medicine up the teat in an upward, I'm still pinching down here, and I'm going to push the medicine up into the udder, and I'm going to massage that medicine very firmly up into the tissue of the rear udder here. Okay. And there, we're done with that one side. Okay. So now we just repeat for the next side. Orifice. Very clean. You've got to be very clean. You need to wear gloves, as I'm doing here. You need to use alcohol. And if that prep pad is pretty dirty like that, I'll use another one. There's no downside to being fastidious when you're doing things like this, where you can introduce bacteria into an area where there's not supposed to be bacteria. There's never supposed to be bacteria inside an udder. Okay, so that looks good. So we're going to go ahead now. I'm going to shake this second tube. Pop our cap off. Grab that teat end. Oh yeah, you can see the orifice really well there. Just line it up. Twist it in a little bit. We're being very gentle. Only to that little ridge that we have. I'm going to go ahead and start putting the medicine there. Okay. I am firmly gripping the teat onto the nozzle. And we're starting to put the medicine in. I'm firmly holding between my middle finger and my thumb. Yes, I know. My patient is being very good for now. She's got food there, and just make sure that, you know, like everything else we do, that we're moving calmly and smoothly. Okay, now I'm pinching firmly the end of that teat so no medicine's going to come back. We're going to squeeze it up. Push that medicine up into the gland tissue. Massage it up into the rear udder. Okay. And this was something I forgot to actually show in my milking video, but now that we have infused her and we are done with our procedure, I'm going to dip her with my little dipper here. It's a non-return dipper. I love this, it's called the low profile one. I think I get it from Valley Vet. Anyway, and I have a barrier type iodine based dip in here that I really like. Anyway, so we're going to make sure that there is some to dip up in that reservoir. You're going to go up all the way onto the teat. Repeat. And that's how you should have proper coverage for your dipping. I'll show you that we have all the way around full coverage on those teat ends. And that's how you do a proper post dip. And so now she's going to be dried off, and we're going to have kids here hopefully in February. So if you like this video, go ahead and subscribe. Feel free to share these videos. Feel free to message me with any questions. And thanks again for trying to learn. Again, just always find out the information and go ahead and subscribe. And I hope to make you some more videos as we go along.